Welcome to Natural Remedies from your kitchen. Today I have my son again with me, Daniel, and he's going to help me as we put together some simple remedies that you can use at home. Today I'm going to show you what you can do with herbs, how to make infusions and decoctions, and even some compresses and poultices that you can use for bug bites, for broken bones, just to help to heal your body a natural way without medications. So let me begin first by showing you that I have a pot of boiling water going here, and I'm going to add some comfrey leaf. Comfrey leaf tea is excellent for broken bones. It really helps speed the healing when you have suffered some type of fracture. Even with sprains, I have seen it done marvelous work. So I'm just going to add this to my boiling water. There we go, Daniel. And this is going to make a nice tea. People always also drink comfrey leaf tea for their lungs. It's been known to help with mucus problems and congestion. And you can grow this beautiful plant right in your own yard. It's big green leaves that are very, very beneficial. And some people have warned that it's a dangerous herb because if you take too much of it, it's going to cause you to get sick and maybe throw up. But as Dr. Schultz always said, he says, what's the worst thing some herbs can do to the body? It can just make you throw up. So we're not going to sit here and say that comfrey leaf is going to kill anybody, because I don't believe it certainly would at all. Okay, so we'll just turn that down here and let it simmer a little bit. And then I'm going to show you what you would do with charcoal. One of the products that I have here today is activated charcoal powder. Activated charcoal powder is a must in any natural remedy kitchen. It is a must for the person who's using alternative therapies and alternative remedies. Charcoal has been used for years for stomach problems, for vomiting, diarrhea, nausea. It can cause constipation if you use too much of it for too long, so you want to make sure that you use it as needed and make sure that your bowels are always moving. But charcoal is what they call an absorbent or adsorbent. It has the ability, each particle, to draw many times its weight and adhere to it and get it out of the body, and it has a tremendous healing power that way. We have used it for slivers in my fingers. I remember the time I once put it on my finger, it drew the sliver right out. They've used it on toxic symptoms, such as a pharmacy recommends having it in your medicine cabinet because it can help with poisonings. It can absorb 3,000 drug residues, so there is also a caution, don't take it when you're taking medications because it can absorb toxins. Also, it's excellent for poultices for, let's say, an inflamed liver. People have also told me stories where they have used this product when they've had, let's say, inflamed joints. They put it on their joints overnight and it's helped. Even with puffy eyes and pain in the eyes, I've seen people make compresses and put it on their eyes. So today I'm going to take some charcoal, and also what we have is cornstarch. And we're going to simply take equal parts of these two items and mix them together with some water and make a paste. Now you can also use ground flaxseed. I've even seen people use the flaxseed, the charcoal, equal parts, and some olive oil, and it works very well that way too. So all you want to do here is get yourself a spoon. I got a little measuring cup here, and we'll take, let's say, we'll just take a teaspoon of this and a dry bowl, and we'll mix in a teaspoon of charcoal powder, and it doesn't have to be exact, and a teaspoon of cornstarch, just a little bit more here. And then you want to add just a little bit of water. You don't want to add too much at first because remember, you're trying to make a paste out of this substance to make yourself a poultice. Okay, so you mix this together and see how it's thickening up here? It's starting to make the paste we want. Turns to like mud. I remember the time that Christ healed the man by spitting into the ground and applying the clay to the man's eyes. He made a little poultice that way, and it healed the man from his blindness. So let's take this here. There, that looks very good, huh, Dan? Mm-hmm. So we'll take now, I just get a little piece of a cotton cloth, like an old t-shirt, and I'll lay that down right here. Let me move this handle. We'll move this down right here. I'll set these two aside, so we don't need them anymore either. And we'll move this a little. And take this and just put it on this cloth. Very easy to do. See that? And then spread it out a little bit, Dan. See that? Now let's say you came to me and you had a bee sting. Okay? Let's say you got a bug bite or something of that nature, or something you needed to draw out. How about a big boil maybe on the skin? Charcoal is excellent for drawing the pus up to the surface and helping that boil to, you finally want it to break so you can help the infection. But you fold it over like this and you have it where the thinnest side of the cloth is going to be here where you have most of the charcoal exposed. Now you can either take this and just dip it a little bit in some warm water is what I like to do, and it kind of just gets the charcoal activated here. I know that women also use a poultice of charcoal. My friends, my wife has used this for any type of a breast infection. Simply place it on the infectious site and leave it there overnight, and it always, every morning, it's usually gone. So Dan, let's say that you had a bug bite right here on your hand. And we would take something like this, a poultice of that nature, and leave it on there. And it's going to draw those poisons out. So it'd be good even for a snake bite. So that's one of the benefits of charcoal. And I used to take charcoal and just mix this with water anytime my children are vomiting or have nausea or diarrhea, and it'll help absorb the bacteria and the viruses and what your body actually is trying to throw off. In fact, they say that if you gave it to a child and the child vomited, you want to try again and try to get it down them and let it help their stomach absorb those toxins, okay? So that's an excellent way of using it. And here's one other I'll explain real quick, is you can just get something as simple as a Band-Aid, a regular Band-Aid like this. I'll peel this off. Take this Band-Aid out. We'll discard this. And you can take this Band-Aid, pull off the protective strips, take a little bit of the paste. Let's say that somebody had even a pimple. And we could take that paste, Dan. Want to try it on one of your hands? Your finger. You got a little infection there. Perfect. We'll put that charcoal on there, and that is going to do a miracle. This stuff really has a drawing effect. Now let's go back a minute and explain about the tea we've made here. This looks nice and done. What you want to do with this comfrey leaf tea now is simply get yourself a bowl and strain the liquid out into the bowl, which you can drink as a tea and also make a compress out of. And you also have the herb here that I've boiled up that's kind of soft, and we're going to use that also for a poultice. So let's do that right now. So remember, just take, I like to add like a handful of, let's say, the ground up comfrey leaf to about a quart of water or so, and let that come to a boil and just cover it and let it simmer for about 20 minutes. That's what you call an infusion. See, tea with just taking a cup of hot water and putting it in a tea bag. An infusion, you usually want to take that boiled water, you can even remove it from the stove, then add your tea, cover that with a lid and let it sit for 20 minutes. You want it to steep out all the properties and the healing properties of those herbs. But if you're using something more like a seed or a bark, like slippery elm tea, that's excellent, that forms a mucilage, so it swells up like jello within the intestines. It's very cleansing and sweeping and healing to the large intestine. It actually comes out with a consistency like an egg white. Has a little maple smell to it, and it also is very good for sore throats. People who have sore throats, we give them slippery elm tea. They even make slippery elm lozenges. But in this case, when it's a bark or a seed or a root, you need to not make an infusion, but what they call a decoction. A decoction is when you put this herb, let's say, about this much in maybe a pint of water or a pint and a half, and bring that to a boil and let that root and that bark sit there at a medium boil for about 15 minutes, 20 minutes, even longer, because it's going to take more aggressive cooking to get the nutrients and the properties and the healing properties out of a bark than it is out of a leaf. So you need to be a little more aggressive in your cooking technique. So let's look at the poultice now. First of all, let's say that my son sprained his wrist and we need to make him either a poultice or a compress. I'll start first by showing you something simple as a compress. A compress, you just dip this cloth into the tea. That's all you have to do. Remember, when you sit there and boil that herb, you're going to lose the nutrients in the water. That's why we steam vegetables and we don't boil vegetables, because we're going to lose the nutrients in the water. We throw it out when we dump that water out. So we've made ourselves a compress here, and all I want to do now is just simply fold it up like this. And let's say he has a sprained wrist. I'm going to take this compress, look at this, and just simply wrap it around his wrist like this. And then what you can also do, hold that a minute, Daniel, whether you're using the poultice or a compress, just get yourself some plastic wrap, like I've done here in the kitchen. And this will protect the clothing and the rest of his body from, let's say if we made a charcoal poultice, from getting it all black, especially if you're going to keep something on overnight. Let's say we made a poultice for his liver, and we're going to put this on his liver. We want to wrap them in plastic and then maybe an old cloth so it doesn't get all over your bed clothing and all over your sheets and whatnot. So now you're getting your finger well with the charcoal poultice, and you're getting your sprained wrist well with the comfrey compress. But let's show them how to make a comfrey poultice. You can take fresh herb and wet it, or take, as I've done here, some of the herb as I've brought it to a boil and let it simmer for a few minutes. This is nice and wet, just like the charcoal poultice. You take some of that and you place it on here. Let's say he has a sprained ankle. So we need to put a lot on. This herb is so cleansing, friends. It's so healing. And it has the ability, I've used it on people before, and their broken bones have healed so much faster. The doctor said it's going to take weeks for this to mend, and it goes back and it's mended within, let's say, 1 week instead of a few weeks. So here we have it nice and wet. You can also dip some of this into the tea. You could dip the whole thing in if you wanted to. And now I would simply apply this. You got another arm? Why don't you put your arm here? Let me move this pot a little bit out of the way and turn this completely off, okay? But we could take this. Let's say that you had a broken wrist, and we put this on there. Now, there may be a cast on there, so I could even give you comfrey leaf tea. So it's going to help you inside as well as outside. But it really has the ability of helping inflammation, broken bones, swelling, things like that. Of course, in a swelling problem or a sprain, you'd want to ice it. But at the point of where that swelling's gone down to a degree, poultices like these are superb. There's one other little tidbit I'll show you here, and that has to do with a couple items. As I went to Dr. Schultz's healing crusade, he had a product called Anti-infective. Anti-infective, this is excellent for wounds. He was talking about bed sores, people with wounds, diabetics that can't heal these wounds on their feet. He said you put these drops right in that wound. And it also has in here, which is really neat, pine sap. What pine sap does is actually puts a film and a protective coating over that wound so that it won't get, the bacteria won't be able to penetrate in there. So this anti-infective contains garlic juice, golden seal root, usnea, myrrh, pine sap, echinacea root, tea tree oil, kelp, black walnut inner holes, and it has also cayenne, of course. There wouldn't be a Dr. Schultz formula without cayenne. But watch this stuff. Put it on here like this. Say that I had a big cut here in my hand. And this stuff dries, and you can see right here, you can rub your finger and you feel your smooth skin, and then it kind of drags because of that pine sap's formed a seal. Isn't that interesting? Feel that, Dan. Feel that? It's like a seal, like a thin layer of wax or something on there to protect that wound from further damage. The other item that I have today, made from plants, it's called Phytobalm. This is an excellent product, again, for putting on sore muscles, putting on spray, let's say if he has pain in his back. I know my wife and I love it, and this stuff is remarkable. You simply take some of this and apply it, and you know what? This stuff gets very hot. When I first used it, I thought it was pretty weak formula by Wise Woman. And I called her up and I said, you know, I thought this was a weak product, but I want to tell you it's not. This stuff kicked in. It's like strange stuff, you know. The next day it kicks on like someone flicked a switch and it starts getting real hot again and penetrating. In fact, I was out burning brush out in the country the other day and I had put a bunch on a sore shoulder and I didn't even feel the medication on there. And when I started burning that brush, you know what happened? This shoulder started burning with it. That heat activated this stuff and it is good stuff. You want me to put it on you? You sure? Okay, I'm going to unbutton your shirt here for you and we'll just rub it right on your trapezius muscle here. It's got oil in it. In fact, I'll read you the ingredients, but this stuff is one of the best natural remedies for sore muscles, and I've never used anything that lasts so long too. So this contains within it, it contains arnica, which is a plant that's excellent for pain and swelling and bruising. It contains rue, calendula, St. John's wort, cayenne, wintergreen, tea tree oil, camphor, and peppermint. That smell good? But don't touch your eyes with this stuff because it'll burn them. Well, that's it for today. And I want to thank you again because this has been our last series of natural remedies from your kitchen. God bless you. Bye-bye. Welcome to Modern Manna's Lifestyle for Excellent Health, Part 6. Today we have a very special program as we conclude our 6-part series on natural healing for you and your children. We're going to go over a number of natural remedies and herbal remedies and the like that you can use to restore health into your children or help them if they get simple problems like colic, fever, in earaches, stomach aches, colds and flus. We're going to tell you what you can do, and I know that you will really enjoy this presentation. You see, I have 4 children. I have 4 children ages 2 years to 11 years, 12 years, she just turned 12, and I've been using natural remedies on my children since they've been born, and I have found tremendous success with them. In fact, my children are, you could say, allergy-free. You know how many children have allergies? There are so many kids that are plagued with allergies, and I believe the problem is because their parents have introduced food into their system too soon, the wrong type of food. They've given their kids starches like rice cereal when they should have gave their children fruits, simple things that their immature digestive systems could absorb. So I want to talk to you first of all in regards to your children about diet instructions because that's the important thing you want to do right now to lay the foundation for your children. An angel from heaven gave diet instructions to the parents of one character within the Bible, and that was Samson. It says the effect of prenatal influences is by many parents looked upon as a matter of little moment. But heaven does not regard this so. The message sent by an angel of God and twice given in the most solemn manner shows it to be deserving of our more careful thought. The angel appeared to the mother and father of Samson and said, "Let her beware, neither let her drink wine or strong drink, nor eat any unclean thing. All that I commanded her, let her observe." So it's critical for us to realize that diet instructions for the infant is critical if you want that child to be healthy. But not only that, the mother under prenatal influences needs to follow a very strict plan. We know the effect of cigarette smoke has on the unborn child, and I showed in one of the sessions a newspaper article showing the damage that alcohol does to the unborn. In the womb, you need to begin the nutrition for your child. Not when the child's born, but the time when it's forming within your womb. So prenatal influences definitely play a part on the health of your child and what he will experience as far as a healthy lifestyle goes the rest of his life. By the command of God, Samson's mother was placed under the most solemn obligation to exercise self-control. The mother must be controlled by principle, and the child's training for the same begins in the womb. The well-being of the child is affected by the habits of the mother. The character of her children will depend vastly upon her habits before their birth. Self-indulgence, impatience, and exacting attitude versus self-denial and self-control. Alcohol and tobacco endanger the physical, mental, and the moral health of the child, as does a poor diet. You know, you've heard it said when the baby's in the womb to play soft music, classical music, to read to the child even while it's in the womb as it's developing, that this child can hear the mother's voice and the father's voice. So prenatal influences definitely play a part in that child's disposition, his immune system, and his overall health. So diet during pregnancy, we need to look at a couple factors here that you need to consider. Great changes are going on in the mother's system during pregnancy. A greater amount of nutritious food is needed to increase the quality and quantity of her blood to nourish the baby. Remember, she's feeding two people right now. It's not just herself, it's the baby. So she's eating for two, and that's very important to remember. Unless she has an abundant supply of nutritious food, she cannot retain her physical strength, and her offspring is robbed of vitality, and many children are born diseased. A diet of fresh fruits, vegetables, legumes, grains, seeds, and nuts contain all the elements to make good blood, and avoid the following: fatty, spicy, and sugar-laden foods. That's right, friends. I see mothers that are having children drinking alcohol and smoking cigarettes. And you know, it troubles me so bad, and I know it troubles many of you. When you take cigarette smoke into the body, you are cutting off the oxygen supply to that infant, to that unborn child within your womb. And that child's going to pay for life. Think of the mothers that are addicted to drugs, the mothers that are eating junk food, that are drinking 5, 6, 7 Cokes a day. That poor child is going to be born impaired, weak, probably allergic to a number of different foods, and definitely going to be plagued by some of the diseases that we see so frequently within our children. So the first food for that baby, once it's born, should always be mother's milk. Let's look at mother's milk, which we call the best food for the infant, is the food that nature provides. At the time of breastfeeding, we learned that this is a very special time of bonding between the mother and the child. It's a very important time because that child came from that mother's womb. It's been inside the mother for 9 months, and now to hold that child close against the mother is very critical for building the child's security. The comfort to know he's cared for or she is cared for. It also is the food from mother's milk that provides the colostrum. This is a lightly yellow-colored liquid that comes before the mother's milk, and it's loaded with immune agents, immunoglobulins. It has the immune system and builds the immune system that the baby needs for good health. In fact, I've read where it is packed with the mineral zinc that is critical for immune function. So then we look at the nutritional start from mother's milk. It contains the vitamins, the minerals, the protein and amino acids, and the antioxidants. Mother's antibodies are while the infant's immune system is developing, she is providing the infant the necessary antibodies through the milk and through the colostrum. So think about that a minute. Think about the poor babies that are born. They're in the hospital, they get the glucose water, and then they're on a formula. See, friends, in that formula it lacks the things that I believe that God put within it. It lacks the interferon. It lacks the antibodies from the mother. It lacks perhaps the high quantity of zinc. It lacks the probacteria or the bifidus acidophilus that the baby needs for its whole immune system and developing the ability of the intestines to absorb B vitamins. So remember, if you have the choice, always breastfeed your child as soon as it's born. It contains, as I said, within the mother's milk, interferon. Interferon is a substance within our bodies that is necessary for a healthy immune system. Also, as I said, bifidus acidophilus. This is the good bacteria that the baby will get from the mother's milk to produce B vitamins for the absorption of nutrients. If that child does not have the bifidus acidophilus, it is going to suffer. It is not going to thrive as well as a child that is drinking mother's milk. It also is easier to digest. It contains enzymes, and we've talked a lot about enzymes, even chlorophyll. It has fiber in it, and the children who consume breast milk early in life, in the beginning, have half the year infections that children on formulas have, and 1/5 the respiratory infections. In fact, there are 2.5 times fewer digestive upsets, and mother's milk protects the baby from colds, diarrhea, sudden infant death syndrome, eczema, asthma, and even obesity. So remember that, friends. If you are having a child or you're pregnant at this moment, make sure that when that baby's born, you're going to bring up that baby on the best food that nature provided and God has given you, and that's breast milk. Also, I want you to know that when you begin to feed the child, it's very important that you feed this child the proper food in the proper way. I believe this is the reason why our children do not have the allergies that plague so many other American children. And here's the reason. We need to first of all have patience while the digestive system matures in this little delicate baby. Breastfeed your baby for up to 2 years. Do not feed the infant until it is at least 6 months old, if possible. I know on a couple of our children, we didn't start feeding them till they were about 9 months old or older. You want to let the digestive system mature before you start putting solid foods in there. It says here also that the diet instructions below will prevent food allergies. You know, Sharice and I had read a book, and it was called Feeding Baby Naturally from Pregnancy On. And that book told us, and it was written by a pediatrician that had seen thousands of little babies in her lifetime. And she said that if you feed the baby the following way, your child will be free from allergies. She said the problem is that pediatricians will usually tell the parents the first food you want to feed a child at about 6 months of age is rice milk. See, rice is a starch, and a starch needs to be mixed with saliva within the mouth. So if you take rice milk, let's say, as the child's first food, and you put it directly into that child's mouth, that child doesn't chew it. It may not even have any teeth yet. So it swallows the starch, and the stomach says, this is a pretty big piece of food. The particles are too large, and it attacks it as a foreign matter and produces a lot of mucus within the child. So as a result, you have the chronic runny noses, the earaches, some respiratory problems, let's say some swollen tonsils, and the child begins to fight the food rather than to absorb it extra well and be benefited by it. So the first food we recommend, and this is during the first month of food, is fruits only. Babies have a very delicate digestive system, and fruit is easily digested. So blend fresh fruit in a blender or smash a banana. That's the easiest way to do it. When you first start feeding your child, you want to use ripe, fresh fruit. Okay, and we use a banana and 1 fruit at a time for about 3 days so you can see if the child's going to have an allergic response. So let's say we're going to feed the baby its first food. We take a little bit of a banana, and you want to get a banana that's brown and speckled all over the place because it's turning from a starch to a sugar. The more brown that banana is, the more sugar it contains, and the more sugar it contains, the easier it will be for the baby to digest. So you take the speckled banana, you peel it, and you take just a little bit of it and you just smash it with a fork. It's very simple. And you give the child a little bit of a feeding here. You don't want to stuff them with too much food. Now the child may say, this is delicious. I want to eat this whole banana. But its system may respond by gas, nausea, maybe vomit, so you don't want to give them too much at once. Maybe a couple tablespoons full, and let the delicate digestive system mature. So then you're going to feed the child banana the second day and the third day and watch and see if there's any allergic reactions. Then we like to get like an apple or a fresh pear. Now get fresh. Don't use jarred food if you can help it, because the enzymes are destroyed. So you take some apple, little bit of water, put it in a blender, zip, it's all done so quickly, so easily, and again you feed the child for 2 to 3 days of the apple. Then after that you bring in pears, then you may want to bring in peaches, you may want to bring in apricots. So you continually feed the child this manner, and you'll find that the digestive system will perfectly well handle these fruits. They're very easy to digest. So start with just 2 or 3 tablespoons per meal and increase them as needed. And wait 20 minutes before breastfeeding your child, because you don't want to dilute its digestive juices, okay, and cause further problems. So the child's first diet is fruits, and then on the second month we're going to do something different. We're going to add now what we call fruit vegetables. Use the foods that contain seeds or are seeds themselves, such as squashes, green beans, and peas. Follow the diet instructions listed in the first month. So we're going to take now peas, and we're going to take green beans and squashes, and these are very simple things to feed the child, and they love them too. You'll be surprised if you start feeding your child Kool-Aid in a bottle and some of this junk food from cereals, you're going to have a child that won't eat green vegetables, is going to cry and complain if you try to give it something like green beans and peas, and you're going to have a child that's going to sit there and grow up eating the wrong type of food and always craving lots of sugar. In fact, there's going to be a lot of dental cavities, bad complexion, and that child's going to pay the rest of his life because you did not introduce food to that child's life properly. On the third month of food, you want to add now the vegetables that are a little harder to digest. So you add fresh and cooked vegetables like broccoli, carrots, potatoes, yams, etc. Now I know the children, they love yams. That's right, yams they love. And they're so sweet, they're so nutritious, and those yams contain so many properties that child can use for growth and for energy. So we like to do things like take, at this stage, an avocado and smash it up with a fork. And if you have a little seed grinder, you can take sunflower seeds and grind them in that seed grinder and mix that broken up seed or that powdered seed now in the avocado and smash it all up. Or in banana, the children smack their lips and they love it. So remember, don't combine fruits and vegetables at the same meal for the child, because it can cause some gassy stomach and cause some indigestion. So grains now, getting to grains, we're on the third month of food. By this time the child's teeth should be developing. And the way the anatomy works is, at the time the teeth are developing within the child, simultaneously they're beginning to develop a starch-splitting enzyme called amylase. God knew exactly what he was doing. They were to have mother's milk until they developed teeth. Then they were to be drawn from the breast and given solid foods, because they could now chew. And when you chew, you mix the food with saliva, and the digestion begins right in your mouth before you swallow it. So grain should be added after the child develops teeth. Starch-splitting enzymes are present at this time. The child needs to chew the grains and mix them with saliva for proper digestion. Maintain a vegetarian diet for your child as they grow older, and avoid animal fat, refined and processed foods, sugar, sodas, drugs, and toxins. Okay? So remember that for your children. You will have children that are allergy-free. There are so many children with allergies. And friends, if you're having a child with earaches, the challenge probably is dairy products. You need to remove them from the child's diet. And there's soy drinks and rice milks. I'm often asked the question by parents also, can I give my child rice milk or soy milk from the health food store instead of breast milk? Well, friends, at that time it's critical they get all their nutrients, and these companies that make these milks don't recommend that you use it as a substitute for formulas or breast milk. But if you use anything like that, also you can grind up and make almond milk and sesame milk and cashew milk that are also very beneficial to the child and filled with nutrients and vitamins and minerals that they might be lacking. Let's talk a minute about antibiotics, because so many children are going to be faced early on in life with taking rounds of antibiotics. Antibiotics are prescribed at an alarming rate in this country. Obstetricians and gynecologists write, look at this, 2,645,000 antibiotic prescriptions every week. Is that amazing? Pediatricians and family physicians lead the way, prescribing over $500 million worth of antibiotics each year just to treat one problem, that's ear infections within children. I want to tell you a little story now about a couple people who brought in their children to see me that were having ear problems and some other problems. One lady had taken our cooking school, and a few weeks later she asked if she could make an appointment and come see me. And I said, absolutely. So she came into the office and she had her 2.5-year-old son with her. And she said to me, Danny, something's going on with my son and I want to see if you can help, because we're putting him through a bombardment of tests and x-rays and blood panels in the hospitals trying to find out what's wrong. But they found that his liver panel was abnormal and also that his spleen was enlarged. And the first question I asked the young mother is, has your child been on many antibiotics? She says, has he? He hasn't been off antibiotics since he's been born. This child has been on 7 different types of antibiotics. He has recurrent ear problems, recurrent colds, runny noses, and the like. And I said, well, let me show you a little book I have. It's called Encyclopedia of Natural Health and Healing for Your Children. And I opened up this book right in front of her eyes, and I said, I want to talk to you about antibiotics. Antibiotics do have associated side effects, some of which may cause irreversible damage. This is another reason why antibiotics should be the last choice for treating bacterial infections. All antibiotics are unsafe during pregnancy, as they can cross into the baby's bloodstream through the placenta. Between 25 and 75% of the mother's concentration of penicillin or tetracycline crosses into the baby. The common side effects include, number 1, liver damage. Did you see that? Liver damage. Number 2, allergies. Number 3, destruction of valuable intestinal bacteria. Number 4, vitamin K deficiency necessary for blood clotting. Interference with the absorption of nutrients can induce thrush. Diarrhea due to a disturbance in the beneficial types of bacteria in the intestines. Skin rashes and phlegm. You know, as I showed this to the mother, some light bulbs went on. She says, well, what do I do? I said, well, what I would recommend is, first of all, get your child off dairy products. And wheat is another suspect food that many children are allergic to. Let's get your child off wheat and dairy products and start him taking some children's glyceride that contains a number of different herbs that will help, such as echinacea. Echinacea will boost his immune system and double and triple his white blood count. So the mother said, that'd be fine. I said, we also have some herbal ear drop oil. We'll put this in his ears. Instead of the antibiotics, we'll try some natural remedies. And you know what else? We talked to the mother and told her that she should consider giving the child some garlic. In this case, the Kyolic liquid garlic is very effective, very easy for the child to take. They seem to enjoy it. They don't seem to balk at it. And if you have any problem, you can put it into some juice. Also, we need to get the child some bifidus acidophilus. And here is a good one from Wakunaga, the people who make the Kyolic garlic. This is called Chiodophilus. You simply open up a capsule and pour it right on the child's tongue or mix it into a little juice and have them swallow it down. So the mother came back to me in 2 weeks. And you know what she said? She said, Danny, I got great news. I just got back from the doctor and his spleen has shrunk and his liver panel is normal. Just from getting off the antibiotics and getting on the probiotics, the garlic, the echinacea, we boosted that child's immune system. That young mother had tears in her eyes, and as they usually do, brings out her checkbook and writes a $50 donation to Modern Manna and says, I want to continue to support your work because you're helping people. And I don't have time to tell you the times that this child has been in tears, stressed out, with all those hospital visits, all those doctor visits, pricking his skin, taking these x-rays. She says, why did they do all this? Friends, I'm sorry that you have to go through that. But the medical profession is pretty ignorant sometimes when it comes to these natural remedies and the role that milk has in causing these allergies. Just recently, I had another child that a mother brought to me, and this child was plagued with earaches. She had been on antibiotic after antibiotic, and you know, I put her on the same type of program, get her off the dairy products, and this lady went back to her pediatrician. And the pediatrician looked in that child's ear, and you know what she said? In 1 week, I have never seen this child's eardrum so clear since I saw it the first day. And the mother said, well, we got her off dairy products, all milk. And you know what the pediatrician said? She says, I know that's true, and many children are allergic to dairy products, but we get a little uncomfortable recommending that your child get off dairy products because of a calcium deficiency. Oh, friends, remember the second session of our lectures when we went into dairy products? Please, the African Bantu women feed 10 babies, breastfeed them for 10 months each, and they have no calcium deficiency and only take 250 milligrams to 400 milligrams of calcium from vegetarian sources and have no calcium deficiency or osteoporosis in their culture. So the other thing I want to talk to you about here a little bit about antibiotics is this. When you take rounds of antibiotics, you destroy the good flora within the child. And the good flora is their acidophilus. And here's what acidophilus does in the body, and bifidus acidophilus. And you need to know this because this is what's being destroyed, the good flora. It says friendly bacteria produce several vitamins, including B1, B2, B6, biotin, folic acid, niacin, pantothenic acid, B12, PABA, and orotic acid. That's nearly the whole B complex. That's for stress, for growth, for metabolism of food. Friendly bacteria actively suppress the growth of harmful bacteria and fungus, including Candida albicans. Friendly bacteria helps improve digestion by producing digestive enzymes. Friendly bacteria help to regulate normal bowel function, proving beneficial for eliminating both diarrhea and constipation. Friendly bacteria, it says, help to reduce intestinal gas and halitosis. It also enhances the immune response of the gastrointestinal tract, produces bacteria for vitamin K. Friendly bacteria produces lactase, which is essential for the digestion of milk, sugar, lactose. Friendly bacteria produce several natural helpful antibiotics. And friendly bacteria reduce putrefactive bacteria byproducts and enzymes that are harmful to our health. Isn't that amazing? So this is what happens when you don't breastfeed your child or you give your child a number of antibiotics. You are destroying their good flora that's critical for all of that. I need my superfood, and I'm getting it. So let's remember this one, and as we move on here, let's go to the next slide and see the side effects here of antibiotics that I talked about. Liver damage again, allergies, destruction of valuable intestinal bacteria, vitamin K deficiency, interference with the absorption of minerals. It's all in this book. And Candida albicans. This is a fungal overgrowth that can cause the white coating on the tongue. It can cause vaginal infections. It can cause recurrent earaches. It can cause athlete's foot, fungus in the fingernails, all of this. Skin rashes in children, phlegm. You need to remember this when you give your child these antibiotics. Use it as a last resort and not as a first resort. This is a slide that I believe we saw earlier in one of our earlier sessions, just telling us that disease never comes without a cause, that God has endowed us with a certain amount of vital force. He has also formed us with organs suited to maintain the various functions of life, and He designs that these organs shall work together in harmony. If we carefully preserve the life force and keep the delicate mechanism of the body in order, the result is health. But if the vital force is too rapidly exhausted, like not enough sleep, too much sugar, drinking caffeine and alcohol and smoking cigarettes, and stressed out, the nervous system borrows power for present use from its resources of strength, and when one organ is injured, all are affected. Remember when I talked about stress? Remember, stress affects not only the hypothalamus, it affects the pituitary, it affects the adrenal glands, so it affects one organ. When one organ is injured, they're all affected. That proves that. And nature bears much abuse without apparent resistance. She then arouses and makes a determined effort to remove the effect of the ill treatment she has suffered. Her effort to correct these conditions is often manifest in fever and other various forms of illness. That's right. Remember that. So let's reason from cause to effect with our children. If your child becomes ill, try to ascertain the cause and seek to remove the offending factors. For instance, ear infections may be caused by dairy products. Stomach aches may be caused by a poor diet or too much sugar or constipation. Fever may be due to bacteria or viruses, even bad diets and pets who carry lots of disease. Colds caused by mucus-forming diets or improper dress or the violation of what we call the laws of health that you saw on the last night, okay? So the first rule that I try to teach people is do the child no harm. As soon as there's a little cough. My little Mia has had a cough for a couple days, and she's having a little challenge with some mucus. I mean, we've traveled all the way to Kansas to make this video series, and my children have jet lag. The time difference is a couple hours. They're not sleeping regularly. We're in strange beds, strange places. They want to play with the other children, and their vital force has been affected. They're breaking down a little bit. So Mia's getting some mucus, she's coughing, so I pull out some echinacea, little golden seal, and I give her some lobelia. Little bit of Indian tobacco there. It helps the body get rid of the mucus. And last night she was coughing this stuff up, and I said the herbs are working. I didn't rush her immediately to the doctor and say, oh, my child's coughing, what do I do? Well, here's a prescription. We'll suppress that cough. Suppress the cough. You know, you got all these dead white blood cells in there, and the body's trying to excrete it. Cough it out, and we're going to suppress it and dry it up in the lungs. Oh, that's real wise. So we suppress the immune response, we dry up the cough, and maybe we'll give the child some antibiotics and set her up for doctor visits the rest of her life. See, my children have never been to the doctor for an illness, because Daddy uses simple remedies from the earth to get them well, okay? There's only one time they were on antibiotics, penicillin VK, for a period of 1 day for 3 of the 4 children. Other than that, no medications, because I use natural remedies to assist their bodies in eliminating the problem. So don't do the child any harm. Evaluate the situation and do the child no harm. Antibiotics and over-the-counter medications are often the first choice of treatment and load the body with more toxins. Herbal remedies and water treatments, on the other hand, can bring relief and assist the body in healing itself. Remember, a fever is a natural defense of the body. Leukotaxis, we talked about that yesterday, to destroy pathogens. Learn to manage a fever and not necessarily destroy it with aspirin or Tylenol. Get medical help if the fever remains too high. So what we do with our children, if our child develops a fever, I maintain it, I manage it. I remember the time that Gianna had a fever of 105, my first child. And she was about, I would say, a year and 3 months old, and I panicked. I didn't know what to do. Oh no, 105, that's critical. The child's going to die. You know, so I went to my health food store and I talked to the lady there, who was 80 years old, who had been working in that store long before I even bought it. And she said, "What's wrong? You look distressed." I said, "Oh, my baby, she has 105 fever." She goes, "Oh, really?" And I said, "What are you laughing about?" "Oh, that's no big deal. You can go home and take care of that one." "How? Tell me, how? Drugs, Tylenol, aspirin, what do I do?" And she says, "No, just go get some catnip herb and make a tea or an infusion and get one of those things you pull the mucus out of their nose and put some oil on it, nice and cool. You want to cool her off. That's the whole point. The body's raising its temperature to kill a bacteria. So let's not destroy its process. Let's help it. Let's lower it a little bit." So I took the cool water enema and I gently put it into my daughter, not knowing what to expect. She smiled. She smiled at me. And then we put her into kind of like a cool tub, not too cold. You don't want to bring the fever down too fast. And I washed her with cool water. You know, in 20 minutes, the fever went from 105 to 101. In 20 minutes. So I saw, don't do the child any harm, but we managed her fever. Everything was fine, and within one day it was gone. Remember, when you get a fever, it's increasing your white blood cells to fight disease. So don't try to destroy it with liver toxic Tylenol. So alternative medicines is the way that we practice medicine. And the aim of the physician should be the prevention of disease. But if a child is sick, you should treat the patient and not the sickness. How many people do that? "Oh, we're going to treat this disease." No, treat the patient. You know, I've been reading a book by John Robbins. It's called Reclaiming Your Health. And in this book, he talks about midwifery. And he talks about the witch hunt that has been done on midwives for years, and how the obstetricians and the medical doctors have basically tried to hang them out to dry and to destroy that natural profession. What did women do before there were obstetricians anyway? But the point is this, that we need to realize that our aim is to treat the patient, and that's what's so beautiful about the midwife. I want my patient, or the person who comes in to see me, I want to dialogue and treat them as a whole person. I want to look at their physical, their mental, and their spiritual person, their being. I want to see the whole person. But how many times do you go to the doctor and you take a ticket like you're trying to get an ice cream at Baskin & Robbins and there's a huge line? And then you're ushered in, you almost feel like, I got to tell them so quickly what's wrong with me because I'm going to be brought in here like a cow and shoved out the next door. There's no interaction anymore. You don't have that personal experience with your doctor, and this needs to be reestablished. And that's one reason why so many people are turning to alternative medicine. They're getting that personal interaction with holistic type healers, the person who wants to deal with the whole person. So if the child's sick, treat the child. Natural remedies are designed to stimulate the body's own defenses, to produce the desired effects, and side effects are rare indeed. First, implement the 8 laws of health, then, if needed, water treatments and herbs may be used to assist nature in fighting the illness and to increase the vitality of the child by stimulating the immune system. Since we have no video to show you this session's going to be a little longer for you because I have a lot to share with you today. I want to tell you also that there was 2 rules of thought when it came to disease. You had Louis Pasteur, and it's documented here in this book called Beyond Antibiotics, and I'll share this with you a little bit because I think it's an interesting story. You have 2 rules of thought when it comes to medicine. You had Metchnikoff's and Louis Pasteur's. Now, Pasteur felt that if we could find the germ, we could kill and destroy all disease. And Metchnikoff, on the other hand, he conducted some experiences, and what he had to say is this. He said the problem that we find here is that it's not the infectious disease, but the host. In fact, Pasteur finally realized that his theories about germs were erroneous. Just prior to his death, he said to have uttered the words, "The terrain is everything. The bacteria is nothing." Pasteur recognized that it was not bacteria that were responsible for disease, but the terrain, the surrounding land, the inability of the host to combat them. If the host was strong or the immune system active, the organisms could not get a foothold. If the host was weak, the organisms could settle in and overcome. Pasteur had come to the conclusion that myriad factors, including diet, nutrition, stress, heredity, environment, and state of mind, had a profound effect on resistance on microbes. Friends, think about it a minute. You're being bombarded with microbes this very minute. They're all around you. Now, why is it that in a room full of people, if somebody with a cold came in and coughed, why is it that one person or part of that room would get the cold and the other part of the room wouldn't? They all got exposed to the bacteria, so all the disease isn't from the bacteria, is it? It has to do with the host, the internal terrain. If the immune system's inactive and weak, you're going to get the disease. But if the immune system is strong and active, you won't. So one person gets all the runny noses, the earaches, one child, and the other child, like mine, don't. Why? Because of the internal terrain. The host is ready to take in this microbe, and it's breaking down. It can't fight it. Think about it. You get a microbe that enters your body. You go to the doctor and you get antibiotics. So the antibiotics kill the microbe. Your body did nothing. Your body says, I'm stepping out of the way. This miracle drug's going to cure the problem, and that's going to take care of everything. We'll give the patient some Tylenol, some aspirin. We'll kill the pain for him. We'll give him some things to sniff up his nose like Afrin and open up all those sinus passages. We're medicated people. We're walking around like a drug factory. When's the last time you used a natural remedy and waited it out a little bit because you're usually too impatient and worried that maybe these eardrops won't work? Friends, I want to tell you today, I don't believe in being foolish. I've seen children go deaf because the parents wouldn't use an antibiotic. And that's where I'm saying as a last resort, but not as a first. But the first thing you should do is remove the cause. Why is the child getting the earaches? Well, he's not drinking dairy products. I don't know why. Is he on wheat? Yes. How old is he? 7 months old. Well, no kidding. Get him off the wheat. It's like a invader on that poor child's immune system. So let's look at this again and learn about the natural remedies in this session that we want to teach you. There's the 8 laws of health, which we went over, called God's Plan in Session 4. Nutrition, exercise, water, sunshine, temperance, fresh air, rest, and trust in divine power. Also, you have water treatments. We talked about hydrotherapy. Let's take, for instance, we'll talk about this. Well, we'll get to a hydrotherapy slide. Let's just do this as an overview. Then there's charcoal. There's herbs and plants, certain supplements, and natural antiseptics like tea tree oil. So let's look at the next slide and see what we can learn. God's plan, I've already given it to you. But remember, this is critical. People need to remember these 8 laws of health. You don't know how many people that I have helped get well simply by getting them to follow these 8 basic principles of health. That's right. I get somebody who comes into the office, I sit down and I say, we're going to take a little questionnaire on you. And I'm going to grade this questionnaire. The best grade's an A, the worst grade's an F. Now, what are your problems? I got migraine, headaches, joint pain, no energy, constipated, etc. Like I said, so the list goes on, right? Okay? The internal terrain, the host is having a problem. So let me ask you the first question. Do you get fresh air every day? No, I work in an office, 8 to 5. Okay, do you get daily exercise? No. So is it fair to put an F by exercise? Yes. Fresh air, a D minus? Yes. Sunshine? Well, when I do get sunshine, I overdo it and I usually burn. So we'll put a D on that one. And how about rest? Well, if I use my painkillers and my natural sleep aids, then I sleep very well. So rest, what do you say, about a C? And they said yes. How about lots of water? Well, I drink 6 Diet Cokes a day. Doesn't count. So you get an F on water. And temperate, do you eat between meals, junk food and all that, and nutrition? How's your nutrition? The standard American diet. So you got a D. Now, how do you feel? I feel about a D. Well, that explains it. You're living a D. You're not following the 8 laws of health. So if I get people to get proper rest, good water, not eating between meals, and the junk food out, daily exercise, walking, fresh air, and trusting in God, I get a patient back in 2 weeks, 3 weeks, a month. That's a new creature. They're well. And I didn't have to give them one prescription other than God's plan. And I believe the majority of illness in the world is because of a violation of these 8 laws of health. So remember that. Let's talk about hydrotherapy a minute. Simple water treatments. You get people with migraine headaches. Headaches. One of the best things you can do is a hot foot bath. Put the patient's feet in water, and you want to bring it up to maybe 104 degrees and get their feet in that water, cover it up to the ankles, and have a tea kettle there to add more hot water to it as it begins to cool off. You can also wrap them in a blanket, give them some cool water to drink, maybe an ice pack on the back of their neck or on their head. This will drive the blood from the head and draw it down to the feet, relieving headaches and migraines. It's also helped women with female disorders in the pelvic area. Also hot and cold fomentations. This is where you take simple towels and you have yourself a nice Turkish cloth or a wool cloth or a cotton wool cloth, and you use it and dip it in hot water, or we'll put it in water and put it even in a microwave and run it for about 4 minutes till it's very hot. And you got to be careful. And what we do is, say a person has lung congestion, we lay a towel on their chest first. You never want to put this hot one directly on their chest. So we set it there, cover it with another towel, and let that heat penetrate deep within their tissues into those lungs. It's going to draw blood and increase the white blood cells to the infected area. So you leave that on for about 3 or 4 minutes, and then you pull it off and you have yourself a bowl of ice water with some ice cubes in it and maybe a mitten. And you take this cold mitten friction rub right on their chest. Now you're going to want a woman to do it to another woman and a man to do it to another man, but you rub that chest like this, and now that cold just drives the blood deep into the body. So you have the heat drawing it to the area and the cold driving it deep, deep into the tissues, and this speeds healing. You want to repeat that about 3 or 4 times. Always keep your patient comfortable. You can even cover them with a blanket. Also put a thermophore or a hot pad under their back to increase the amount of sweating. And you want to put their feet even in a hot foot bath. We also give them some hot tea to drink sometimes. It helps induce sweating, and keep a cool towel maybe on their head, and also have cool water. You want to keep your patient hydrated. So at the end you'll see they look like a lobster. They're all kind of pinkish and red. That shows that circulations happen and they've got the desired healing effect. You also have cold tub baths. We all know about those. That'll help your circulation. You also have cold compresses. We've all used those for a headache, a black eye, maybe ice packs, let's say over here for a swollen ankle, or you've sprained a muscle. Cold showers is a very beneficial way. Hot and cold contrast showers. I remember the time I went to Weimar Institute. And you know, at Weimar Institute, they had a shower there with 16 shower heads. 16! And that thing was shooting me in the head, in the back, and the sides, down my back, all the way. 16 shower heads. And they had this thing as hot as it could go. I remember the time I first did this contrast shower, hot and cold, but I didn't know what was really going to happen. And I remember the technician took a fire hose off, and turned this thing on and started squirting me with this high pressure hose up and down my spinal erectors, down my quads, down to my calves. It felt fantastic. It was like getting a massage with water. And then he did this thing. He turned it to cold. And I went, oh, I gasped. I about lost my breath. And he did this 3 times. And I want to tell you, when I got out of that shower, they had this sheet there and they did this wind bath on me. Then they laid me down and I got a massage for an hour. And then some hot and cold compresses to my sinuses. If you've never done that, you'll learn water is a powerful healer. A powerful healer. And hydrotherapy is so beneficial. Even people who are children, sometimes they'll have a 101 fever. We'll put them in a fever bath and raise their temperature up gradually to 104. We want to increase the white blood count. We also want to have their immune system boosted by doing fever baths, and that's very, very important. Fever baths are wonderful ways of healing your children and getting their temperature up gradually. So somebody would say, you mean to tell me you increase the child's fever with a fever bath? And I said, absolutely we do. We do that, and then you find that that child recovers. You're assisting nature in the healing of the patient. So you have wet sheet packs that are very beneficial. They've used these on smokers. Also steam inhalation or steam baths. So you can use water in liquid form, in steam, and we also do this with our children. We use like a vaporizer or a humidifier at night with vapor inhalation drops, and these drops contained lavender, eucalyptus, and thyme. It's very beneficial. The children breathe these fumes of eucalyptus and they get well. Do that for their lungs, for their sinuses. So you can use water as steam, water as ice, or water as liquid. It's very, very beneficial. Charcoal is another natural remedy. We showed you some demonstrations the other day, but charcoal is a light and fluffy black powder made from burnt wood or bone. We use the wood, of course, and it has electrostatic properties developed in activated charcoal during production, which favor the binding of most poisons. This is excellent for poisoning. You should have it around the house. We showed you how you could use it for bug bites, for nausea, for vomiting. It's a powerful absorptive substance that has been used as an antidote since the 19th centuries. Some of the many uses of charcoal are indigestion, gastritis, gas, diarrhea, nausea and vomiting, intestinal infections, inflammation. We've used it as poultices on sore joints, inflamed liver, kidneys, eyes, everything. Helps with bad breath, drug overdoses, poisoning, toxic metals, disease germs, insect bites, and even compresses. So remember, charcoal is a wonderful, wonderful natural healing aid and should be in every home. Also, the leaves of the trees are for the healing of the nations. We showed you this slide yesterday, just showing that God has caused to grow out of the ground herbs and roots that every person should learn how to use for themselves and for their children. Herbs are excellent healers, and we should learn how to practice with them. So herbs and plants, I like to call it God's pharmacy out in nature. And herbal remedies and their preparations include infusions, we demonstrated that. Decoctions, we taught you about that. Tinctures, you've seen us use a number of those. Compresses and poultices we've used, and even oils. I have one oil here. Oh, I didn't set it on the table, but it's lavender oil. It's excellent for headaches, and you can put it in on your finger and just rub it on your child's temples, and it has known to help with headaches. Also in the bath, it can help soothe and relax and to heal. The aroma of that oil is very, very beneficial. So here's another herb we've talked about already called garlic. I don't know what more to say. I'll tell you what, there's been a lot of people who have been sick around me this week. I believe the devil doesn't want these videos made. And there's been a number of people that have been ill around me, and I'm staying in the same room with them, and I've eaten so much garlic. You saw me that one day making that Italian cocktail. That garlic, I believe, has been the key instrument with echinacea and some other herbs to keep me well through this whole shooting. I want to tell you that garlic is a powerful, powerful herb. It's used all over the world. It's recommended. And it's important, I think, that we bring out before we talk about garlic here. I want to tell you this, that in Japan and other countries around the world, in some of the largest pharmacies, they now have garlic as one of their pharmaceuticals. It is a medication there that you can get from the doctors. In fact, it was garlic, or one of them was, I think, the #1 prescribed drug in one of these other countries. I just heard from Dr. Schultz. He said, why is it in their pharmaceutical catalogs, but we're not finding it in American catalogs? This is a powerful medicine, and if we're going to be honest on what medicine is, then we need to include garlic because it heals. Here's some other actions. The other slide we showed you yesterday talked about its effects on the heart, cardiovascular effects, but it's also an antibacterial, antiviral, antifungal. It helps with colds, flus, fevers, infections, earaches. It's great preventative medicine. It's immune enhancing, anti-cancer, and it helps in the elimination also of intestinal parasites, high cholesterol, and even reduces high blood pressure. I'll tell you what, garlic is a powerful healer. Echinacea, my favorite herb, we talked about that. This is something you should learn to use with your children. Now I'll tell you this, Dr. Richard Schultz had an excellent statement he made when using herbs, and I also learned about the use of herbs when I went to a natural healing crusade in Oregon, or an herb symposium, and they began to tell us about these herbs, and so many times we're afraid to use them. Oh, we give our children 2 or 3 drops here or there. You know, I'll load my kid with some of these herbs. They're harmless. Echinacea, you have coltsfoot, elecampane, cherry bark. These are excellent for the lung, for colds, for things of that nature, respiratory infections. And I'll take this herb and I'll squeeze it in the bottle, and that's probably about 40, 50 drops right there. And that's about a half a dropper full. And I'll give it to my children, even my 18-month-old child. I will give the child this much 4 times a day. You can give them 20 drops. In fact, on this formula, it says use 20 to 60 drops 3 to 4 times a day. And Dr. Schultz said, you know, the formulas that he tested on people, he said they were wimpy. These formulas were too wimpy. He said most of the echinacea formulas he tested across the country didn't even have any echinacea in it. It was mostly water. So you need to get a good product and trust the company you're with, or find out if they're reputable, and use a lot of that herb. Don't be afraid to use it. Don't wimp out. He said, you know, he lost faith in herbal medicine for a while because he wasn't getting well and he couldn't get his patients well. So he had to design his own formulas. And he got the best herbs and made the most potent formulas, and he tested hundreds of batches on them on himself before he would say, there's the quality I'm looking for. And he's healed thousands of people because he has good herbs. So get good quality herbs. Wise Woman Herbals is the company that I feel very good about. I know that these are organic and wild-crafted herbs. This company has its own farm. Cheryl Tilgner is a friend of mine. She's going to be at our Health Expo West and speaking this year on herbal medicine, and take us on an herb walk and show us the plants out there in nature. I want you to know about these products. You need to get good herbs. You need to know what you're buying. Your child may not get well. It's not because the natural remedies wouldn't work, it's they can't work. There's no quality herb in that product. So let's go to echinacea again and look at some other functions of it. It enhances the immune system, it's antiviral, it's wound healing, it helps with low immune function, acute and chronic infections, and cancer immunotherapy. Learn to use echinacea. It is a wonderful, wonderful herb, and you'll be blessed, and your child will be blessed by you using it. We showed you this slide yesterday again. The yellow content of golden seal is berberine. It's an alkaloid that has antibacterial, antifungal properties. It's antimicrobial, anti-infective, anti-tumor. It activates macrophages, white blood synthesis or white blood cells. It helps infections of the mucous membranes. It also helps in parasites in our water and the effects of chemotherapy and radiation and the destruction that they make to our cells. Here's another one that I use frequently within children because it's very beneficial for sore throats and the like, and for intestinal problems or irritated bowels and stomachs. It's an herb that we call slippery elm bark. This is an excellent plant. In fact, I showed you that the other day when I did my segment on natural remedies in your kitchen and was teaching you how to make an infusion. But slippery elm bark is astringent, it's anti-inflammatory, it's a demulcent, emollient, and don't get excited about these words. We're going to show you what they all mean here in a minute. Nutritive, pectoral, it's for colds and coughs, for colitis, constipation and diarrhea, for asthma, bronchitis, and all pulmonary complaints. It soothes and irritations. It helps sore throats and stomach inflammations. In fact, it was in Essiac tea. Remember, it was one of the ingredients in Essiac tea. So let's look at the therapeutic properties of herbs. They're astringent. Herbs that influence the contraction of cell walls and tissues, makes them denser and firmer, and arrests improper discharges, like black cohosh, chaparral, echinacea, mullein, plantain, and red raspberry. When we use the word demulcent, it means herbs having mucilaginous properties. That means it kind of swells up like jello. It says that are soothing and protective internally to irritated and inflamed surfaces and tissues. So it would be good, I would say, for a problem like Crohn's disease or irritable bowel syndrome or even diverticulitis, borage, cayenne, chickweed, corn silk, licorice, slippery elm, sage. Detergent, herbs that are cleansing to wounds, ulcers, etc., or to the skin itself. Black walnut, golden seal, prickly ash, and shepherd's purse. Diaphoretics are herbs that produce insensible perspiration and increase the elimination through the skin. It's going to cause sweating. Bayberry, blessed thistle, bloodroot, hyssop, red clover, shepherd's purse, white oak, and wormwood. Or it's diuretic. That's going to increase the secretion of the flow of urine. Juniper, marshmallow, buku, boldo, bilberry, asparagus, and even watermelon are some of those plants and herbs that will have a diuretic effect. Also, if it's an emetic, these are herbs that induce vomiting and cause evacuation of stomach contents. There may be times when you need to purge the system because somebody has swallowed some poison or something of that nature. There's blue flag, lobelia, mistletoe, pokeroot, quassia, wood betony. Now here on my child I use lobelia. If you give lobelia on large amounts, it will induce vomiting. You'll have a child that'll puke up a bunch of mucus. Dr. John Christopher used to do that. But I've given my child minute amounts of lobelia, and it's stimulating her. It's also an expectorant. It's making her cough. She's coughing the mucus up, and that's what I want her to do. Emollients are herbs that are softening, soothing, and protective to external tissues like chickweed, coltsfoot, elecampane, fenugreek, and mugwort. Expectorants are herbs that promote and facilitate discharge of mucus secretions from the bronchial pulmonary passages, the lungs, comfrey, elecampane, fennel, golden seal, horehound, horseradish, lobelia, slippery elm. Hepatics are herbs for the liver. They strengthen and tone and stimulate the secretion of the liver, like dandelion, Oregon grape, milk thistle, even golden seal. Nutritives, herbs that are nourishing and build the body, burdock, dandelion, mullein, oats, red clover, saw palmetto, and sheep sorrel. Sedatives, herbs that tend to calm and tranquilize the body or the organs of the body, like blue cohosh, hops, skullcap, thyme, wild jam, and valerian. In fact, there's a formula that has valerian in it, it has hops in it, and skullcap that has been used as a natural sedative, a natural relaxant. So let's look at one book I have here. I'll show you a picture of it. This is Home Herbal. This is the book we recommend. This book is excellent because it teaches you how to make formulas, how to make infusions, how to make decoctions and oils and all these things. The book is absolutely easy to use. It's totally user-friendly. It gives you step 1, step 2, step 3, such as making cough syrups. You go over for infusions, step 1, step 2, step 3. It is so simple and practical to use, friends. Everybody should have one in his or her library. We recommend this book highly, Home Herbal. In fact, I'll show you here on the screen, if you want to look at a larger picture of this, how to make herbal remedies. We have a lot of fun with this book. We like to go out into the yard and pick eucalyptus and come back in and use that eucalyptus and make ourselves maybe a cough syrup or something of that nature, and our children love to do it. As I showed you, there's a page on infusions, on decoctions. Here's one on decoctions here. Shows you how to use the seeds and the roots and the stems and how you need to boil these a little bit longer to take the properties right out of those plants, and then you strain it into a pitcher, cover it up, and you have that herb that you can drink for a medicinal purpose, okay? Also shows you how to make compresses and poultices, which I demonstrated the other day on my little son, right? Very simple, making an infusion or a decoction, dipping a cloth in it, and then applying it to a wounded area. So let's just briefly wrap up as we go through some of the problems that children have, such as diarrhea. What can you do for diarrhea? Diarrhea is loose stools and cramping in the large intestine. It's one way the body evacuates toxins, germs, and viruses and other irritants. Breastfed babies usually have loose stools, but diarrhea can cause dehydration and a loss of potassium, so we need to give plenty of fluids. First of all, I like to check the baby's feeding habits, and then such as their food sources and allergic foods. If a child's having diarrhea, it could very well be caused by dairy products. It could be caused by the formula. It could be caused by, let's say, medications, a bacteria, a virus. It could be caused by wheat, a number of different things that could be caused diarrhea. So what we want to give the child, we have here a list of ingredients that are very, very beneficial and easy to use, such as activated charcoal. Activated charcoal is an excellent natural remedy. It can cause some constipation, so you don't want to keep it up for too long of a period. Also, the good acidophilus. We've cleared up children's diarrhea just by giving them bifidus acidophilus. Rice water is another natural remedy. Carrot soup, carob powder, slippery elm tea, and liquid garlic. Those are excellent natural remedies that you can use for a problem such as diarrhea. Very simple to treat in many cases. Colic or a gassy stomach, we find that babies constantly complain. There's prolonged crying, arched back, tense body, gas, and it usually happens during the first 4 months of life. But the problem could be simple enough that the baby is just sucking air, or the formula is wrong, or the mother's diet contains things that are gassy foods like onions and garlic. Could be from cow's milk or even tension in the mother. That's true. If you're very tense, your body doesn't digest food very well, and her breast milk could not be that healthy. Some tidbits on breast milk too, while I'm on the subject, is drink red raspberry tea, even brewer's yeast. These superfoods have been known to enrich breast milk. Fenugreek tea, fennel, they can also help you produce more breast milk, and also drink lots of water. Women who are not producing enough breast milk aren't drinking enough water usually, and they can help enrich their breast milk with red raspberry tea because it's high in iron and will give you iron-rich breast milk for your children. So colic could be caused by overfeeding, not adequate burping, poor elimination, and some herbs that are beneficial are catnip or chamomile or just a good old hot water bottle, something like this. Just fill it with hot water, put it on the baby's tummy, and many times it will soothe the child. But I like to use the herb catnip. Very, very beneficial and effective. Let's look at something a little more serious, like the common cold right now. A cold, remember, is viral in nature. It's viral, okay? And many health practitioners believe it may be nature's way of cleansing the body. A lot of people believe that this cold is simply the way the body's throwing off mucus and getting rid of poisons. Stress, toxins, poor diets can affect the body's immune system and its ability to fight the virus. A cold affects the upper respiratory tract. and may induce headache, runny nose, congestion, sore throat, and even cough. You should assist the body in cleansing. So begin treatment immediately. With hot fomentations, foot baths are very beneficial for helping to break a cold and to stop it at its onset. Echinacea and golden seal and garlic are excellent herbs. I've read reports where these herbs can actually, let's say a cold will run a period of 7 to 10 days, it can cut it down to less than that, maybe even 3 to 5 days in length by using these herbs. A humidifier with eucalyptus oil. Eucalyptus is superb for colds, sore throat, coughs, respiratory problems. Vitamin C, 1,000 milligrams every 2 hours, or with a child, I give them perhaps 100 milligrams every 2 hours if it's a young child. Also, make a natural cough syrup that we showed with the pineapple juice, the lemon juice, and the honey. Open their bowels, make sure their bowels are open, they're not congested. Avoid sugar, dairy products, and meat. High fatty foods, high protein foods are terrible during the time of a cold. Eat lots of fruit, okay? Plenty of fluids, and herbs, again, like children's glyceride, let's say, for lung support. Very, very effective. The earache is something that affects millions of children, otitis media. It's most common found in children between 6 months and 3 years. It's caused by a blocked eustachian tube, which can cause pain and infection. One study showed 81 of 104 children tested positive to allergies, mainly from milk and wheat. I'd say 90% of the children that I get with earaches is caused by dairy products. Simply do that first. Get them off dairy products and you'll see 90% of them improve. So no dairy products. Other allergens like wheat, give the Bifidus acidophilus, herbal ear oil, garlic and onion. We take an onion, cut it in half, put it in the oven for about 15 minutes, soften it up, let it cool down, and place that onion on the ear. I did this to my little daughter one day, had an earache. Had it there while she was sleeping for about an hour, hour and a half. She woke up, it was gone. Has a drawing, antibacterial, antipathogen properties in onion. Also, charcoal poultice has been beneficial on the ear. Echinacea golden seal to stimulate the body's immune response and kill pathogens and bacteria. Enemas for fever if necessary, as I explained earlier. Plenty of fluids and vitamin C. All these natural remedies can boost that child's immune system, help you beat that problem. Remember, on fever, it's very important. I think this slide tells the story. It's not a disease, it's a symptom of illness. It's not a disease, but a symptom of illness. Fever is a reaction of the immune system to the invasion of bacteria and viruses. It's a natural way our bodies fight infection. A fever may accompany a cold, a sore throat, earaches, pneumonia, measles, etc. Too much greasy fried food and sugar can bring on a fever. So what do you want to do for fever? Cool sponge baths, catnip enemas, echinacea golden seal, yarrow is excellent for lowering fevers, vitamin C. The good probacteria is always plenty of fluids, encourage the child to rest, and mild foods like fruit that are very cleansing and will also help stimulate their bowels to move. So children's glyceride, just to show you one of our favorite products from Wise Woman Herbals, is an excellent herbal formula that is drying, decongesting, anti-inflammatory, antimicrobial, and supports the immune system. Contains echinacea, that's a white blood cell stimulator, anti-inflammatory, antiviral. Cherry bark, a respiratory tract tonic, expectorant, lung function. Elecampane, specific for lung conditions and builds the immune system. Golden seals, astringent, antimicrobial, immune stimulating. Colt's foot supports the cilia in removing debris and mucus. Herbasante is an expectorant, microbial, bronchial dilator. Asthma, it's beneficial for asthma. Osha relieves spasmodic coughs and alleviates congestion. Ginger is a diaphoretic, increases sweating and relieves fevers. And cayenne protects the lung cells from damage and increases circulation and will carry those herbs, and it's very, very beneficial. So the Christian physician, there are many ways of practicing the healing arts, but there's only one way that heaven approves. God's remedies, friends, are the simple agencies of nature that will not tax or debilitate the system through their powerful properties. Pure air and water, cleanliness, a proper diet, purity of life, a firm trust in God, are the remedies for the want of which thousands are dying. Yet these remedies are going out of date because their skillful use requires work that people do not appreciate. Fresh air, exercise, pure water, and clean, sweet premises are within the reach of all, but with little expense. But drugs are expensive, both in the outlay of means and the effects produced upon the system. That's from one of my favorite books called Counsel in Diet and Foods, written by Ellen G. White, my favorite nutritionist. You know, she said that 100 years ago. That's right. She said that these remedies are going out of date. But you know what? They're coming back in, aren't they? She was right. They're making a resurgence into the American population and public, and people are excited about it, and they're beginning to use them again. So I want to thank you for paying attention today. Some other books I want to show you that you may want to purchase. You can get, let me first show you our catalog again, Modern Manna's product catalog. There's over 1,000 items in here, from juicers to dehydrators. There's also distillers and wheatgrass juicers. We have videos, audios, a number of educational tools to help you get on your way for health. Also, it contains a number of books in there. One of them here is by Dr. Agatha Thrash and Calvin Thrash, MD, on charcoal, how to make the poultices. Talks to you and tells you about the benefits of charcoal and exactly how it works. It's very beneficial. Another one by Dr. Thomas, PhD, on hydrotherapy. This is a user-friendly manual that's very easy to use. It gives you illustrations in this book, pictures, how to use the products, how to administer the treatments. Here's the cold mitten friction I was telling you about. The ice-cold mitten, rubbing it on the infected or the wounded area, the area you're trying to invigorate. All right? So remember, that book is very beneficial. Another one is Today's Herbal Health for Children, a comprehensive guide to understanding nutrition and herbal medicine for children, by Louise Tenney. This is an excellent book to teach you about herbal remedies and childhood ailments and what you can do to build the immune system. A very user-friendly book on herbs is How to Herb Book. I use this herb book for years, and many people have too. They like it. It's very easy. It tells you all the herbs for a specific problem. If you have a certain illness, it tells you what herb to use also. And another book that's pretty popular is The School of Natural Healing by Dr. John Christopher. This is a big, thick book, and all his expertise and knowledge gathered over the year. It's one of the most elaborate books and comprehensive books that I have found on herbal medicine, and I would recommend that maybe you look into this book. So remember these natural remedies. One last one that I'll tell you about is if you have athlete's foot, apple cider vinegar is very beneficial, even for people with dandruff. It's been used as a natural deodorant under the arms, and it's helped with fungus problems and the toenails and the like. Apple cider vinegar used externally for that purpose has been very beneficial. You can also soak your feet if you have athlete's foot problems in pineapple juice, and even lemon juice has been very beneficial. Never forget the benefits of lemon. It's an excellent healing, has healing properties, and we have a little book that you can obtain for just $1 called The Miracle of the Lemon by Celeste Lee, is the one who's putting that out right now, and I would urge you to get a copy of that from us, and we'll send it to you right away. Another product that I just want to show you briefly that's made from herbal tannins, from babel bark, Swedish birch bark, has also a quebracho extract. This is from the barks of trees, also is very, very beneficial in killing Candida fungus. Very, very beneficial. We love this product. It's as effective as diflucan and nystatin, they say, in treating Candida overgrowth. So remember this product, Tanalbit. I know there's many people out there plagued with fungal problems, but remember, if you have Candida, build the immune system. It is an immune problem. And that's what Dr. Balch taught me. When we were together speaking in Colorado, Dr. James Balch, who wrote the book Prescription for Nutritional Healing, Here it is. It's a thick book. It's 600 pages long now. You can look up any disease and it tells you all the natural remedies. I highly recommend this book, and he's a good friend of mine, a very good friend. We love each other very much. And he said to the audience one day when we were speaking to a few hundred people, he said, the problem that we have today is a suppressed immune system. That is the killer in America. We look at chronic fatigue syndrome, we look at cancer, we look at heart disease, we look at all these diseases today. He says there's one disease, and that is a suppressed immune system. So remember that, friends. This whole program's to help you build your immune system and live a healthier life. So thank you for your attentiveness. Thank you for watching this video series, and contact us and write us letters. Let us know what you think about this video series, and pray for us that we can make more of these serials, that we can get Modern Manna on a syndicated TV show across the country with a half-hour cooking segments and demonstrations and lectures all over the world perhaps. So pray for us that that can be accomplished. And thank you. I want to thank you for being here, because without you, this program would never, ever exist. So God bless you, and I'll see you next time.